psychedelic-assisted therapy is difficult to access and not readily available now, there's great hope that there will be some indications, even by the end of this year, from the FDA for psychedelic-assisted therapy.
That's Jennifer Bires. She'll be back later in the show to discuss an experience with psychedelic-assisted therapy with a patient. Welcome to Cancer Buzz, the podcast expressly for cancer care professionals. I'm your host, Summer Johnson. On today's show, we're diving into an intriguing and rapidly evolving issue in modern oncology, and that's the use of psychedelics to treat emotional and existential distress that often follows a cancer diagnosis. Research in this space is gaining serious momentum as a promising alternative to traditional mental health interventions for issues like depression, anxiety, and adjustment disorder. Later in the show, we'll hear from Dr. Manish Agrawal, co-founder and CEO of Sunstone Therapies, who's leading the Rekindle study, a trial looking at the investigational psychedelic medication RE-104. But first, we want to look at the human side of this kind of treatment. Joining us today is a patient, Judy Wight. She's a breast cancer survivor, and Jennifer Bires, Executive Director of Life with Cancer and Patient Experience at Inova Health System in Northern Virginia. Jennifer also serves on the ACCC Board of Trustees. Wight participated in a Sunstone Therapies study on the use of psilocybin. Judy, let's start with you. You were diagnosed with early-stage breast cancer in 2019, just as COVID was hitting. You've described a delayed reaction where, despite a successful surgery and radiation, you felt stuck in a deep depression. How did you find your way to this study?
I was a little bit, numb and on autopilot for a while, and everything worked out. I had very good doctors, and I guess what drove me to this treatment was that after a couple of years, I had kind of a delayed reaction, I would say. I got very depressed, and I was kind of a mess, and I sort of realized I'm going to die, and even though I was okay, I thought that might actually happen. That will happen. It was not just an intellectual exercise. So I started trying a number of treatments for depression, and, each one kind of helped a little bit, but I was still pretty stuck. And so I saw a show called How to Change Your Mind on Netflix, which is a fascinating show. And it talked about psychedelics and, other types of drugs. And I started searching around for studies. And I was very lucky to find this study. And I applied for it. And I had decided that I didn't want to die a depressed person. I wanted to feel better. And, enjoy what I had left in life. And so cancer really kind of led me to that. It led me to this day.
Jennifer, can you talk to us about when you met Judy and you started having these conversations with her about this treatment?
When I met Judy, it was really powerful to hear her story, and just hear how she was being impacted by her diagnosis and life stressors, and also to hear all the work that she had done to try to help herself cope with some of the side effects like depression that she was experiencing, and she was still struggling. So a lot of work that we did initially was, one, getting to know each other, and her feeling comfortable with me and me knowing more about her study. And also talking about what is a psilocybin experience, what can someone expect while they're having one, and how could she enter into that feeling the most prepared and the most safe so that she could get the most out of it. by the time I had met Judy, she had already decided to participate. And so a lot of our work was really around preparing for that experience.
What are some of the things you told her to prepare for?
A lot of times we want to help patients set intentions. So really understanding what she's hoping to get out of the experience, but also encouraging them to hold it lightly. We never can really dictate how a psychedelic or a psilocybin experience is going to go. And so really learning what brought her to the experience and what she was hoping for, and also creating a space for uncertainty and the fact that the experience is going to unfold how it unfolds. Also did some grounding exercises. What can she do if she feels nervous in the session? How can she use her breath or her body awareness to help support her during difficult times? We talked about touch. Would touch be useful? Would it not be useful? How does she want me to know that? How does she want me to let her know that I'm there and support her? And so really just a lot of what are the possibilities to expect, and also what are the tools that you can use during a session, and helping to, really ensure that she could, if people haven't had an experience, it's really hard to know what to expect. And that can be scary. And so how can we give her all the tools that she needs to feel as safe as she can and still do something that is full of uncertainty?
Is that what you felt, Judy, talking to Jennifer before you started?
I really didn't know what to expect. I was very curious and excited to try it. And Jennifer and all the folks at Sunstone gave me so much support. I felt very safe and well prepared for whatever may come. I knew that I would be taken care of.
I think that sometimes when we think about medications or psychiatric medications, it's, take this medicine and you'll get better or you won't get better. But really, when I think about psychedelic-assisted therapy, the medicine is a piece of it, but that entire container, that preparation, that integration, how the room is set up, the support from, the MAs going into the room, to the therapists, to the physicians involved, to the nurses, that's all part of the experience. So I love, Judy, hearing you talk about just how supportive the entire environment felt, because this can be a little different than how we traditionally approach medicine and how we traditionally approach mental health care.
Judy, what are some of the other forms of mental health counseling that you tried prior to looking for this study?
I didn't know I was depressed until my 40s, really. And something triggered me and I fell into a deep depression, and I was like, I have to do something. And I went to an EAP and saw this guy 3 times, and he was like, oh, you have dysthymia. It's kind of this low level depression that's just there. I was like, oh. And so eventually I went to my primary care physician. He put me on fluoxetine, and that helped for a while. It was kind of a revelation. I felt better, but that didn't last. And then I tried Lexapro for a while. After cancer, when I went into that deep depression, I was just like, I got to do something. And another primary care doctor suggested I try trazodone. And I went off Lexapro and went right into trazodone and went down. That's what kind of sent me off a cliff into that very deep depression. And so then I finally was like, okay, I need a psychiatrist, somebody who understands drugs better, and found that person. And he put me on Wellbutrin, which had a great effect, but still, still not there. And then after seeing How to Change Your Mind, I looked into ketamine treatment, and I started that. And all along, I've had counselors, I've had therapists. I wasn't just doing drugs. I was, and all along, little bits and pieces, getting a little better, but still, not there. So ketamine helped, definitely. That's a very helpful drug. And then I was like, I really want to try psilocybin. I want to try that, because I'd heard good things about it. And so then I looked into Sunstone, so it's been a journey, definitely.
What was your experience like then after you were prepared by Jennifer?
It was amazing. It's hard to put into words the dramatic change it was for me. It was finally, I think, I cried and cried and cried and cried and cried. There was just a lot of stuff that I could not access. And psilocybin allowed me to access it in a way that I had never before. Past traumas, current stressors, decisions that had been sitting there in my mind, and I just didn't have like the courage to do it, to make a change. It was many, many hours, it's like a full day. And, I think you could just take the drug and still have kind of an experience. But I think the whole thing, all the therapists, all the preparation, Jennifer in particular, it's like she was the right therapist at the right time. I was really able to just crack open. And, I remember sitting up during one session and going, why don't they let people have this drug? It was so helpful to me. And also a soft experience, not a harsh chemical experience. I could probably talk for days about what the experience was like. And, it wasn't just the drug experience and the therapy, it was also integration afterwards. And I think that was extremely important. There were other people in the study and we got together. We all talked about what the experience was like. And then again, over time, it wasn't just right after. It's been months and months after when we check in every once in a while and we, have conversations, where are you? How is integration going? How are you feeling now? And, at this point, it's not that I'm a different person. It's more like I'm becoming the person I was meant to be, and all those layers and layers of trauma and sadness, I've been able to shed a lot of that.
I want to add, I heard Judy say that she, didn't have the courage. I would say she's one of the most courageous people I've ever met. And it wasn't for a lack of courage. She had worked so hard and tried so many things. And I think one of the beautiful things about psychedelic-assisted therapy is it's another tool in our toolkit for something that is really difficult to treat and really hard to put our finger on. And so for some people, one-on-one talk therapy is going to work great by itself. Yeah. And for other people, maybe one of the available psychiatric medicines is going to work. But for some people, no matter how hard they're working, there's a block there, or there's an inability to access a piece or understand something in a different way. And so what was so beautiful about working with Judy is not only had she been working so hard, is that she did have this incredible transformation and ability to look at her experience and her perspective in a different way. And again, not a magic wand, but just like a new tool. And I love that you use the word transformative because you really did transform. And that doesn't mean you walked out of there a different person, but, the energy in the room and how you felt and how you were approaching decisions in life was really significantly changed in a very positive way for you. And that it's so amazing to think about having another tool to help people access that.
Jennifer, this is a broad overview question. How did interest arise in using psychedelics for emotional treatment and cancer?
I think many classic psychedelics have really long histories in ceremonial healing that have been used in different cultures since the beginning of time. So while this feels new in Western medicine, it's not necessarily a new concept. Certainly in the 50s and 60s, psychedelics were studied pretty extensively in psychiatry, and there were studies on anxiety and end of life distress. So, really tailoring to serious and chronic illness. Much of that research, all of that research, was halted in the 70s with the Schedule 1 classification of psychedelics. And that was really due to regulatory and cultural shifts, not because something dangerous had happened in those studies, but really just a shifting of policy and politics and the war on drugs. But in the 90s, or really over the last 2 decades, research has really started to resume using a really modern clinical trial framework, which focuses on safety and ethics and defined therapeutic models. But one of those early trials was in people with advanced cancer. And in that trial and some of the subsequent trials, there's been really promising results. These are on really limited populations, so small in size. Certainly, these studies are incredibly difficult to blind. But, Judy's not alone in how she explains her experience. We hear from patients, and there is data to show that when done right with the right population in cancer, that these medicines can really be quite transformative and quite impactful, with so many caveats on safety and preparation.
And then what made you interested and want to explore it?
I think I became very interested because as a therapist I've worked in cancer my entire career, and I've worked with patients for long periods of time, and we've done such incredible work together. But I also felt that stuckness that Judy was describing. No matter how hard the patient was willing to work, how hard I was willing to work, how meaningful and deep our work was, I still saw that patients were struggling either with end-of-life anxiety or fear of recurrence. And it was really impacting their ability to show up in life, their well-being, their relationships, their connections. And it didn't matter how many trainings I went to, there was still something that felt like we could do better. And so when I started to learn about psychedelic-assisted therapy and read some of the patient accounts and see some of the research, I said, I've got to learn about this. I think that this could be another tool that would be useful for people in this space where we don't have the perfect answer and we don't have the perfect treatments.
Not every patient is coming with the same perspective as Judy and the same courage that you described her as having. What should that conversation with patients sound like?
I think it's important to notice that all psychedelic medicines are still under Schedule 1. And so being able to access psychedelic-assisted therapy, other than in a few states like Oregon and Denver, has to be done through a clinical trial. And so it's rare that I'm presenting psychedelic-assisted therapy to patients. It's more common that they're going to be asking me about it. Do I think it would be helpful? How could they access it? And certainly I'm talking to my oncology colleagues often as medical oncologists are reading about it and curious about it. So I like to really, one, understand where folks are coming from. Why are they interested? What have they heard about it? Because there's a lot of information in the news and there's lots of stories and books. And so I want to understand what they're thinking and what questions they have. And then I always want to I want to give them really balanced information. So there is, the evidence has been promising, but there's been limited studies. and it makes sense for some people and it may not make sense for others. And so really it's a very individual conversation, but I like to really center it around the evidence that we have available and making sure that any myths that someone has heard or misunderstandings can be clarified as much as possible.
Judy, back to you. You did say that you felt supported by Jennifer and all the folks over there. I would imagine, though, when you're walking into something that you've never experienced before, that you have to have trust. Can you tell us a little bit about how that was for you?
Trust is absolutely a huge contributing factor, I think, to making the process actually, go somewhere. Because I think you can just take the drug, right? But having a whole team of people who were all very well qualified. They had, a whole process that we all kind of stepped through. There was just a general sense of kindness and compassion. There were multiple meetings over time, and all of that kind of built trust. And, there was even kind of not a practice, but, we talked about what's going to happen during the day, when, so you're just kind of mentally prepared, like, okay, I know what's going to happen. And I think that helped me be quite comfortable. I was like, I know what's going to happen. I mean, you don't know exactly what's going to happen, but I know that there's a whole team of people here that are supporting me. And I completely trust Jennifer and all of the folks at Sunstone. They care. They really care about what they're doing. They're very genuine and, trying to study this drug.
Jennifer, a lot of your colleagues listening might be coming in with some general assumptions to this conversation. What would you like to leave with them?
I do just briefly want to mention, because I know that there are a lot of oncologists and administrators and other supportive people in the oncology space that are listening to this, that while psychedelic-assisted therapy is difficult to access and not readily available now, there's great hope that there will be some indications, even by the end of this year, from the FDA for psychedelic-assisted therapy. And as Judy mentioned, it's really a quite complex and lengthy treatment when done well with the preparation. The dosing day can be up to 8 hours, and the integration that happens after. And not every health system is going to do psychedelic assisted therapy, but as we get further into this, really think about how could that be implemented in a health system or cancer center? What type of training would people need? How would people think about access? Because I think the real issue that we will face next is, how do we get people educated, and how do we ensure that patients who need this type of treatment can access it?
Cancer professionals well know that a diagnosis of cancer changes everything for patients, including mental health. If you see a patient experiencing negative mental health changes after receiving a diagnosis, they may be dealing with what is known as adjustment disorder. Reunion Neuroscience is committed to revolutionizing the treatment of mental health disorders by advancing next-generation psychedelic-inspired therapies. The Rekindle Phase 2 study will test whether a single-dose investigational psychedelic can alleviate emotional distress in patients diagnosed with cancer. To check your patient's eligibility, visit rekindlestudies.com. This next discussion focuses on a different study, Rekindle and the use of RE-104. We'll hear from the investigator behind the Rekindle study, Dr. Manish Agrawal.
The Rekindle study is about looking at treatment for adjustment disorder with people with serious illness. And specifically, the largest proportion of that is cancer patients. And, having a cancer diagnosis obviously is very distressing for patients, which I know that after 20 years as an oncologist and seeing thousands of people. And, it shakes people's sense of meaning and facing potential mortality. And really in oncology, we have not had great tools to deal with people's emotional and psychological state. And so the Rekindle study is a study looking at a novel drug called RE104 to treat adjustment disorder in patients with cancer.
What distinguishes the Rekindle study from other studies like it?
Well, Rekindle is the first significant, what I'd say, multi-center study. And so that, it's across multiple institutions across the US, and it's randomizing patients to treatment versus placebo in order to try to get this drug approved for broad approval for treatment of patients. And most of the other studies have not done it for that purpose. They've been studies to see, does this drug work? Do these psychedelics work in this population? How do they work? But not really for the purpose of broad access.
What have we learned so far from other studies?
Psilocybin is the active compound, and we conducted a study that published 2 years ago now in JAMA Oncology, and there we treated patients with depression using psilocybin, and 80% had more than a 50% reduction of their depressive symptoms, and half of the people, 50%, went into complete remission from depression. And so that study is, in fact, what led me to form Sunstone Therapies, because I saw such a dramatic relief. And other studies have been done prior to then, one at Johns Hopkins, one at NYU, another one at UCLA that showed similar results. And then there's been newer studies that are being initiated as well. And so, I think of the different populations that have been used, that psychedelics are being used in, I think the cancer population is the one that seems to have the most promise, along with PTSD. But there has been many studies done here and in Europe that have suggested a significant benefit.
As a medical oncologist for 20 years, what makes you hopeful about this study for the future of patients with cancer?
As an oncologist, when I give talks around this, I have an iceberg, and above the iceberg, I have chemotherapy, surgery, and radiation. And underneath the iceberg, I have what's called psychosocial, psychospiritual, psychological care. And I think true cancer care is treating everything in the iceberg, not just what's above the water. And, as an oncologist, when I was trained at the National Cancer Institute, and I was at the NIH, and I was on faculty there, and then in practice, you really don't get a lot of training around that part of a cancer patient's journey. And yet that, I think, impacts their quality of life more than just the physical symptoms. And so I think what I'm most hopeful about is this is a direct path to get to whole person care in cancer, not just sort of treating the physical symptoms or just treating the tumor.
Thank you to our guests today. You can head to the show notes for more resources on psychedelic-assisted therapies. If you like this show's content, and we certainly hope you do, you can look back through the Cancer Buzz episode catalog, where we examine fresh perspectives and new topics in cancer care every week. Also, make sure you're following the show in your favorite podcast player to be notified when there's a new episode. This show was made possible through the support of Reunion Neuroscience and is a resource of the Association of Cancer Care Centers. Until next time, for the Cancer Buzz team, this is Summer Johnson.